So today's webinar is going to be hosted again by Caroline Constantine, MD of Right Directions, myself, Jill Twell, Head of Development, and Ian Warren, who is Head of Health and Safety. So today's seminar, the aim is to stimulate thought and discussion on how to effectively consult with our staff on COVID-19 and provide appropriate information. At the moment, we're working to the 4th of July to be open. Obviously, that might change with government. However, we need to start to be talking to our staff, and that hopefully will be the key factors throughout today's clinic. We want to ensure that staff confidence is there in their arrangements for health and safety and well-being. We need to ensure that staff are engaged and involved in the measures that we're taking to ensure the safety of themselves and others. And we want to ensure that staff have the confidence to speak, to seek and support if they have concerns relating to COVID-19. And as important, we need to engage with other stakeholders, clients and landlords. We have a session on Friday, which is around staff communications, where we will highlight ways that we think you can communicate with your staff and stakeholders. So today's session is around consultation and what we think you need to put in place. So with no more ado, I will pass you over to Caroline Constantine.
You need to unmute, Caroline.
Good morning, everybody. Welcome to our 8th clinic. We're gradually getting through them. They've taken up a lot of our time actually researching and making sure we're telling everybody what we believe is the right picture. Quick recap for any of you who are new and you haven't sat in on any of our other clinics, by all means, you can find them all on YouTube, and we're also sending all of the presentations out to everybody who's signed up, even if you've only signed up for one. So these are the list of things that we've covered so far. So please feel free to have a look at those presentations. Ooh, sorry, get used to the mouse again. Just to reiterate, the 4 S's, this still applies now for our clinic today: spacing, sanitizing, signage and smiling. And today we're talking about communication, consultation with our staff, mainly prior to opening. What we want to cover today is how we talk to our staff and communicate with them before we reopen. So what we can do now and what we can do in the next 6 weeks, and again a little bit about when they come back to work. So it's development of consultation methods for all staff to ensure they're confident in the measures that we're putting in place, providing an effective platform for them to raise suggestions and concerns, and provision of information to ensure staff are sufficiently advised and understand the new arrangements. So today is really about making sure that we keep talking to our staff. I've been very, very lucky with my team at Right Directions. We've got a team of about 30 staff, and we're all talking to each other every single week, both in a management capacity, as in about Right Directions, but also personally and socially as well. And as a consequence, I've got a fantastically motivated, committed bunch of people working for me. And I think that the communication is absolutely key on how we keep our teams involved. So without, as Jill said, without any more ado, I'm going to pass you over to Ian.
Hi. Unfortunately, you've got the video back today, so long as the internet keeps up, unfortunately, you have to look at me as well as hear me again drone on. As Caroline just said, this is about ensuring staff have confidence in the arrangements you have to come back to the workplace. And the fundamental part of that is about communication, ensuring that they have confidence in what you've done, identifying anyone with particular issues and making adaptations where possible, to help them come back with confidence and know what needs to be done. So to help that, clearly one of the things that you need to think about is what consultation might need to take place, what information you might need to provide them, And who will provide it? If all your staff, apart from you, are furloughed, will you be bringing back someone from HR or another department to try and help you achieve that? And this might be a phased approach, but now is the time to start thinking about these things. Line management of the whole operational process in the lead up to it. How are you going to manage that? And how will information be provided? And what methods of consultation are you going to use? Things to think about. Is it all going to be done by teams where people haven't got access to that? Are you going to try and set up some face-to-face, perhaps in an outside space around the centre with a desk or a table where you can distance and be out in the open air enjoying this wonderful weather at the moment? It doesn't have to be in indoor areas where people might be more reluctant to go. And will you involve everyone? I think that's one of the keys, and I'm sure I'll pick it up later, but everyone means everyone. It means all your 0 hours contracted staff. Think about your summer casuals. Think about your instructors. It's not just your contracted staff you need to be talking to. And please remember, in all management, consultation means discussion. It's two ways. It isn't top down, you telling them. That won't help you gain confidence. And it needs to involve them and enable them to input. And just a reminder, it is a legal requirement under health and safety to consult in the workplace. And this, if anything, needs to demonstrate that you've done that if you're going to gain the confidence of your staff. Okay, next slide. Thank you. So what methods are you going to use? I've already talked about some of those. Is it going to be via social media platforms, WhatsApp, Facebook? You need to consider how they are going to be seen by other people and what information you're going to put out on it. Some of those things could be very helpful in re-engaging staff now. I don't know what many of you have done. As Caroline has said, within Right Directions, every day we have a team spirit meeting, which is put on by a member of staff, talks 99% of the time about social issues, puts on fun games to play, and enables the team to keep connected and be able to understand what's happening within the wider team structure. So things like that to engage people and keep them engaged with your workplace could be something that you might want to start fairly quickly if you haven't already done it, and encourage staff to join in and be involved. Where people haven't got that technology, phone calls, texts, and perhaps letters. You need to think about the information you're sending out, who might validate it if it's important, where it's truly consulting and asking for feedback that is personal to individuals. Clearly that perhaps needs to be done on a more formal basis and not through social media platforms. But Teams, Zoom, you might be able to achieve. Okay, next. And what are you going to tell staff? I think from the other slide, the important thing is to think about who is furloughed and the strategy for bringing them back and making sure they're engaged. There is absolutely nothing wrong with, during the time that this is going on, that staff can be expected to attend CPD sessions and keep their awareness and skills updated. But you might well want to provide the reassurance to them that you are as up to date as can be, that you've attended these clinics, you're attending other online CPD, you're getting guidance from all the different NGBs, and there is a whole range and plethora of it coming out at the moment. You will need to pick through what you think is good, what you think is applicable to you. Some bits unfortunately conflict, but most of it is at least looking in the same direction of trying to think how we're going to get this industry back up and running. So use the information and guidance that's out there, sharing back best practice from the industry as a whole, as well as looking at other sectors. I use it all the time. The supermarket ones, which I think is nearest to it, if you think about people moving around your centre through corridors, having to pass, think how they've done it. And look at some of the guidance that other sectors are sending out. We will also, I hope, be moving to step 2 in this unlock, and that shortly you'll be able to look at the non-essential retail sector guidance, which might also provide us with very valuable information to help us plan our way forward. You've kept up with HSE and government advice will be critical to help gain that confidence you know what you're doing. And clearly the conducting of risk assessments, which you will or should share with them. So you need to be able to demonstrate that you've got appropriate control measures in place and the risks have been considered. And above all, ensuring that they understand that the health and safety and well-being of them is the top priority, as well as your customers, together with getting the industry back going and doing what we can do best, which is helping the country as a whole to get back to an active lifestyle to stop people dropping into the more at-risk categories. Okay, next slide, please. So, identifying higher risk staff. I think this perhaps is one of the first things that you could start doing. Trying through individual one-to-one consultations, find out which staff have got a higher risk profile. The risk profiles are fairly clear, those with underlying health conditions, people that are pregnant, people that are older, probably 55, 65 upwards, and also people with family members at home who are in these high risk categories. You need to try and find those things out. Where somebody is high risk and they're on the front line and you can't put full controls in place, then maybe you need to consider in some cases redeployment or change of work practices. If you've got a small office at the rear that can't possibly fit the 3 people that used to work in there, maybe you need to look at one of them working from home. And remove the person with the underlying health condition so that they can work safely. Conduct individual risk assessments. We've got, you may wish to consider completing an individual return to work, specifically COVID consultation process that will highlight those at risk. Can they work at home? Can they be redeployed? Do any of them, particularly Central London and city centres, do any of them have to travel in at peak times on public transport? Can you rearrange shifts, etc.? You need to understand the issues so that you can build the individual risk assessments. The outcome might influence how you consult with staff who are higher at risk. Okay, next slide, please. So what will you ask staff? I think you need to involve them. As I said, it's a two-way discussion. It isn't a top-down, this is what's going to happen. There's good information from 1 or 2 other organisations, such as Wetherspoon, that put out a survey consultation process, and they got back over 2,500 suggestions from staff as how they can work safely. And I don't know whether any of those suggestions have been adopted, but hopefully some of them are helpful and will be highlighted and praised within their organisation. But to involve them is key to this, to get their confidence, to enable you to get them back to work, and ensure feedback and suggestions are taken on board. Perhaps the compiling of a list of Q&As might be helpful. Okay. So this was the government statement at the last update. I think the earliest any of us can anticipate a reopen is the 4th of July. It could be later if things haven't progressed as far as they have, and clearly we hope they do, because we need to be making progress towards getting ourselves back open and contributing to society, and reducing the risk of jobs being lost. And that therefore, now is the time that you start the full consultation process so that you are prepared and beginning to engage staff, putting measures in place to gain staff confidence, where necessary to train and retrain staff in intervening periods, considering perhaps phased returns. And as I said earlier, you can consult, you can involve staff in discussions, and you can involve staff in training who are furloughed. Keeping their CPD up to date, keeping them involved with what's happened, going to be key to getting back into work. And this must also include, as I said earlier, the 0 hours and non-contracted staff. As an aside, some of you might have heard, which might be offer sustainability for some sites in some of the inner cities. They're considering, I read, co-opting some of the larger halls and sports halls to become temporary courtroom spaces, as there's over 1,000 criminal cases backlogged, and they're considering finding alternatives. So some of you might be able to go out there and put yourselves up, if it's a sustainability issue, of looking at how, while you develop a phased approach, have somebody else paying for parts of your buildings. Next slide, please.
Ian, just quickly before I move on to the next slide, just need to consider Scotland and Wales, who obviously have got, and Northern Ireland, who've got slightly different arrangements.
Yeah, sure. Obviously, yeah, sorry, I am talking about the England and Wales on-lock process. I think Wales have even got some different approaches to this. You need to be aware of your own governments or own devolved authorities processes that they're going through in terms of working towards the unlock, although I think the principles will be the same in all of them. Okay, so what information will you provide staff, and what staff can be expected on their return to work? Be clear in what you're putting in place, be it screens, pre-signing in sheets, confirming non-symptoms, forums to raise concerns. You're putting in loads of sanitisation stations and enhancing cleaning regimes. That those at risk will be considered for redeployment where appropriate, perhaps changing in rotas. Working in teams to ensure that you can quickly isolate any team that may have someone with symptoms. Enhanced hand washing stations and reduce capacities. It would be great if staff can come up with any new measures and that these are highlighted and praised. I've mentioned most of those. Training and one-to-ones we've talked about. Hopefully the track and trace process will help us all in the long run. The daily confirmation that people don't have symptoms when they're coming into work, I think could be key. And if any of you are interested, we're developing a staff signing in sheet and a COVID-19 return to work consultation form. And if anybody wants it, please email us at info@rightdirections and that can be sent out to you. The daily confirmation you have no symptoms, I think, could be a key issue that you need to consider with your HR departments. Staff members that are perhaps on 0 hours or are not contracted, instructors, how honestly are they going to answer the question whether they've got any symptoms developing, whether they feel that they are not well and are going to therefore declare that and self-isolate for 14 days. I think this is really one of the critical points that you need to think through with your HR department and look at the sustainability issues of that. That encourages and enables a staff member who thinks they are unwell to be honest and to say, I think I might have symptoms and therefore I need to isolate, and not have to look at just being on statutory minimum sick pay or nothing at all. You need to be clear in what procedures that you want people to follow if they're feeling unwell. And you need to consider the mental health issues of this. It was a point we picked up from some conversations we've been having with some clients, and it's an area you perhaps wish to consider. And it's human nature that some people perhaps might feel, if they haven't been furloughed, that they're on a different level than the people that perhaps have been furloughed. They might not think they've been engaged and are having an easy life. I'm sure that's not the case. Unfortunately, some of our newspapers are helping perpetuate that myth, and those staff that are doing the consultation, those staff that will be managing people returning, you need to consider and make sure that doesn't come across, because it could set up resentment in the workplace when nobody could have foreseen this. Nobody who's been furloughed really had any option but to take up what's been said. I think some of that could be got over now by encouraging people to take up online training, online CPD, and being fully engaged in the consultation process as to how you get back to work safely. Next slide. So, things you might be able to use to engage staff and give them confidence. And I'm sure, as Jill said on Friday when we have the session on communication, this might be brought up by David Monkhouse from LeisureNet, who's done a large survey of current members about their confidence. Things that can show to staff how you're trying to reduce contact, putting in virtual tours of the facilities to show them what you might have put up in the way of screens, sanitisation points, how you're putting in your systems to help control what will need to be done inside your facilities could well give extra confidence to staff and help them understand how they're coming back in and what they might anticipate. You might also want, as some of the NGBs have done, to consider nominating someone as a COVID-19 champion, to be able to make sure that the systems are overseen and that staff can go to, if they don't feel for some reason able to go to their managers. Maybe a health and safety designated competent person could easily fulfill this role as well. And you might need to think about bringing staff back into the facilities before you fully open so that they can see for themselves. So we know you might well be faced with lots of concerns. We really need to think these through and provide sufficient confidence to enable people to come back. I've talked already about the risk of potential resentment between furloughed and non-furloughed staff you need to think about, but also there is going to be a lot of anxiety out there. You need to think those through, particularly the staff that have to commute, those that have got additional risks, and think through how you're going to provide that confidence to them that what you're doing is sufficient and adequate to enable them to work in a safe workplace, while at the same time making people aware that we're all in this together. Other industries are back up and running and are working successfully without affecting the R rate too dramatically. And there is a risk to society of not enabling people to be physically active, as well as a risk to each of us that there might not be jobs in the long run unless we can get things up and running. So there's a two-edged sword. There's a fear of redundancy and there's a fear of perhaps losing jobs because we're not back up and working properly, or the fear to their own health. Holiday arrangements, depends on what you've done, what you've said to them on furloughing, how that's managed, and whether you're having to think about alternative contracted positions to enable the sustainability issues. They all need to be thought about, discussed through with HR or a sufficiently competent HR consultant so that you know what you're doing before coming back in. Next slide, please. This is just a very quick look at the ONS statistics. It's one way you might convince people that whereas the headline death rate is alarming, everybody might feel, depending on what newspapers or social media they feel, that they're all at risk of catching it and that they stand no chance of survival. Up to the end of May in England and Wales, sorry Scotland, I don't know where your data is, there were 37,000 deaths in the UK and England and Wales. Of these, 88.5 were over the age of 65. This leaves 3,300 in perhaps what we would know as the active workforce. It's also known that around 88% also had underlying health conditions. So if we extrapolate that to all those under 65, this means that within the active workforce, for people that are fit and healthy, only 339 people died. Now, I'm sorry if anyone personally has been affected by this, but perhaps that puts into context that the level of risk within the ordinary workplace. And many of these will potentially have been frontline health workers, care workers who have had no option but to work in heavily dosed, heavily infected areas. So it could be just one way you might be able to put some proportionality on that and help the workforce to understand that whereas there is a risk, the risk to them of catching it is being controlled, and the risk of dying is probably minimal, very, very minimal. And the key focus is on helping the whole of the country bring down this R rate so that we can get back towards a more normal and get back to ensure that our businesses are sustainable and that we're all in this together. Next slide, please. So dealing with concerns, you need to make sure you take them seriously. You demonstrate that you've consulted with staff, could be one-to-ones after an initial survey. Ask individuals daily if they've got concerns. Conduct a daily or weekly health assessment. Make sure staff are being honest. And just be aware of those staff that are really anxious, that have got problems at home, have had issues to go through themselves, and how they might be feeling about some of the control measures that we're putting in place. And encourage staff to look out for one another, confirming confidentiality, and make sure you regularly update staff. I'm afraid this could be in for the long term. This isn't just a one-off and we need to make sure we consider how we're going to manage this, not just in the short term to get back open, but in the long term to help staff have that long-term confidence. And don't forget staff who are still furloughed, those working at home, staff off sick or isolated, and those that have still been working throughout lockdown. And I think overall this slide is more to do with leadership. It's more to do with making sure that whatever controls that you put in place are clearly communicated, and that staff understand what they need to do to help you reduce the R rate, help reduce the risk to themselves and their other colleagues. That training and consultation will be key, and that all staff are empowered and encouraged to be accountable, that staff feel able, that the cleaner is able to call out the general manager if they believe the general manager is not maintaining social distancing, is not demonstrating hand washing. Unfortunately, we haven't got it in, but there was a brilliant clip that came around early in this lockdown period of a series of MASH episodes where they obviously had infections within the MASH units. And there is one where one of the consultants is called out in the middle of an operation for having touched his nose during an operation and having to go out and scrub up again. We need to enable other people to call out anybody if they see them acting in a way that puts themselves or others at risk without fear of any retribution. And it's for the overall common good of everybody. So that, to me, is one of the key points in these. Conducting regular briefings, which unfortunately I think will have to be ongoing, making sure we praise and recognise good behaviour, and that we lead by example, and that liaison with HR might be necessary if further actions are necessary. And I think that hands you back to Caroline. So sorry that was quite a long one, but in essence it's about managing people and expectations. So back to Caroline.
I was waiting for Ian to mention supermarkets and Riddor, but he didn't mention Riddor today.
I mentioned supermarkets.
No Riddor.
No Riddor. It is Riddor reportable. I did know.
Exactly. Oh, I got it in. So that's concluded our session on staff consultation. And I think probably the one thing that we need to remember more than anything is we do include them and we talk to them, and we talk to them regularly, and we tell them the good news and the bad news. All of us have been screaming at the televisions with the likes of Cummings and all those people where we just wish that the government were honest, admitted when they'd ballsed up and kept us all in the loop. And I think if we can do that with our frontline staff and all of our staff, just keep telling them what's happening, what's going on, who's coming back, who's not coming back, who's working in what department, etc., why people aren't coming back if they're high risk, and those sort of things. I think it gives the staff an awful lot more ownership of the centre and them and working in the leisure centre, in the facilities. So just briefly, if anybody needs any support, our risk assessments are going on to Stitch at the end of this week. We're now out live doing mobilisation, reopening checks with organisations. We've got the first ones happening this week. So if anybody wants us to come to their centre and help them with their mobilisation plans, walk the buildings, etc., we can do. And as Ian has said today, we've designed a signing in and out form for frontline staff when they do come in to tick relevant boxes for us to judge whether they're clear, can come into work or not. And a COVID consultation form for managers, line managers, to sit with their staff, preferably face-to-face, and chat through what their worries are and also their suggestions on how they think they can help and how the centre should be managed. I think that's it from us. Over to